All right, good morning, everyone, and welcome to our webinar today. My name is Liz Krupsak, and I am a school mental health consultant at the Wisconsin Department of Public Instruction, and I'm joined by my colleagues, Terry Osage and Jessica Frayne. And we're here today to provide you with an overview of some of our new resources in school mental health and social and emotional learning. So if you have any questions along the way, you can feel free to drop those into the chat. Otherwise, we will take some questions at the end of our presentation today. So we wanted to start by acknowledging that we know that there's a lot going on with our students right now in light of the pandemic. And we also know that our students are very resilient. So we see that students are reporting that as a result of what they've been going through recently, they're feeling a greater sense of self-awareness, a deeper sense of gratitude for the people around them, for their supporters, and that most of them do have a connection to at least one trusted adult. On the flip side, though, we know that a lot of students are also struggling. Next slide. So students are also reporting less opportunities for social connection, lacking healthy coping skills during the pandemic, and just very high and always increasing stress and anxiety and depression. So we know that what we can do in our schools is really take the time to strengthen our universal approaches to promoting well-being and really work on that resilience. So we are today going to go through a lot of different resources that really address that universal level of support for students. All right, next slide. So all of our work here today is rooted in our comprehensive school mental health system. So we recently released an update to our Wisconsin School Mental Health Framework, and one of my colleagues will drop the link to that in the chat. So you can go ahead and read through that if you're interested. But here on the screen, I have a graphic that shows the different pieces of a comprehensive school mental health system. And the first piece that you see on the left is a continuum of mental health support. That's what we're going to be talking about today. A lot of resources that make up that continuum of mental health supports. Next slide. So I'm going to start just by talking a little bit about some of our new mental health literacy and stigma reduction resources. So we recently created a stigma reduction toolkit with our partners at Rogers in Health and WISE, which is a coalition in Wisconsin to address stigma. And the stigma toolkit really tried to take a comprehensive approach. So it includes pieces that can be used by students, that can be used by staff, and that are meant for caregivers. So they grounded all of the pieces of this toolkit in evidence-based practices for reducing stigma. And this is something that you can access on DPI's website for free. And we will drop the link to that in the chat. We know that stigma is a huge barrier to students receiving the mental health supports that they need. So we hope that by having this toolkit, schools can feel empowered to start these conversations about mental health and start chipping away at some of that stigma associated with receiving mental health supports. Next slide. So the student portion of the toolkit is meant to be used with secondary students, and it is aligned to our social and emotional learning competencies in Wisconsin. It's meant to be used in the classroom setting, but it could also be used during advisory periods or with clubs or after school activity groups. It's really meant to be pretty flexible. Any place that you could bring that conversation to a group of students would be appropriate. So the lessons that are included in this student portion of the toolkit include things like learning what is stigma, talking about how you can support peers that are struggling with mental health concerns, how to have positive health for yourself. So talking about affirmations and how to counter the stigma that you might feel about yourself. And then just how to talk to others about your own mental health needs. How do you reach out for support? How do you find those supportive people? All right, next slide. The caregiver portion of the toolkit is meant to pair with those student lessons. So these can include a communication bite to share with each lesson. So these communication bites sort of outline lesson topics and the objectives, and then it provides more information and also other opportunities to continue engaging around this learning and to engage with their students in conversation or activity to deepen the learning. So we know that this is, a pretty light touch on engaging families around this conversation, but the hope is that by just even starting this conversation, families might be willing to take a deeper look at these issues of stigma in their school community. Next slide. And then the final piece of the toolkit is to look at educators' own mental health stigma. So this includes a module on resilience and hope, and it also includes a discussion guide that can be facilitated with staff to help them start thinking about their own attitudes related to mental health. And the video is really cool because it includes a lot of Wisconsin educators talking about their perspectives on stigma and mental health and how that shows up in the school setting. All right, next slide. The next resource that I wanted to share is our new mental health literacy units of instruction. So we partnered with our Wisconsin Office of Children's Mental Health to create these lessons. And the lessons are for elementary, middle, and high school. So we have 3 units that are available. And they all utilize a skills-based health approach. So they were created to align to the National Skills-Based Health Standards. And our vision for them would be that they would be used in a health classroom, hopefully with a health teacher in partnership with one of the pupil services professionals supporting this work. But of course, it could be used in other settings as well. So all of the lessons include resources for differentiating and integrating the lessons into other topic areas. So it can really be a more widespread approach than just health class. And then these are aligned to Wisconsin social emotional learning competencies, and then also Learning for Justice's social justice standards. Next slide. So the mental health literacy elementary units are focused on the skill of self-management. So each of the units utilizes a different skill. So in order to develop self-management skills, these units will have students explore things about like learning about themselves and their mental health, emotions and feelings, understanding how to find people that they can trust, who they can talk to about those things, how to ask for help, how to seek help when you need it. Just building their toolbox of coping skills. So this unit is primarily geared towards grades 3 through 5. Next slide. All right, then we also have our middle school units, and the skill focus for the middle school units is advocacy. So in order to learn the skill of advocacy, students will talk about why they care about their mental health. They'll learn about ways to engage in positive self-talk. They'll learn about different opportunities for managing stress and anxiety. Again, how to seek help, how to ask for help from somebody else, and then what it means to have healthy relationships and how that can affect mental health. So you'll see some common threads that run through all of the mental health literacy units. And then these are geared towards grades 6 through 8. Next slide. And then lastly, we have our high school units. And the skill focus in these units is interpersonal communication. And so students learn about interpersonal communication skills through talking about mental health, learning how to respond to stress, creating their own stress management plans, and then talking about boundaries and relationships in association to their health. And that these units are meant for grades 9 through 12. Next slide. Again, along with the units, there is a caregiver supplement, and these can be downloaded with the units. And these provide caregivers information, discussion questions, and activities that can be done with the student to extend their learning. And it just provides a few more resources that caregivers can engage in around every lesson in the unit. All right, next slide.
All right, thank you, Liz. So the continuum of supports and services provided in a comprehensive school mental health system include both an array of proactive and responsive supports. And they're meant to build the needs or meet the needs of our mental health, behavioral, social, emotional needs, and strengths of each student. So as we know, those shift over time. Those are dynamic features in all of us. So that's why we've kind of moved into more of this continuum model versus that traditional pyramid tiered system. And this system includes mental health promotion, early intervention, treatment services, crisis supports, and recovery supports. And the key to a strong system like this is that solid, universal, or preventative foundation. And this is where we're focusing on our mental health promotion. So we're focusing on promoting positive school climate, SEL for both adults and students, promoting and building mental well-being and resilience. So again, we're working on the stigma reduction and that shared understanding of mental health, and of course, reducing the prevalence and severity of mental illness. Mental health promotion increases protective factors while decreasing risk factors. So as you'll see, SEL plays a huge role, both student and staff, in developing those protective factors. So we'll break this down a little bit and just to see how SEL plays that major piece in the foundation of the comprehensive school mental health system. So we can go to that next slide. So here we're breaking down the why, what, and how of SEL work. And many of us are often focused on the what and the how in our work. And it can sometimes leave that less focus on the why behind what we're doing. And the why is really what drives us and makes our work effective. It's what impacts decision-making, which is very much an SEL skill. So the what you can see in the center of the screen here is our Wisconsin SEL framework. And this is based on the work of our national SEL partner, CASEL, the Collaborative for Academic, Social, and Emotional Learning. And the framework is an organizational tool that provides a foundation for our thinking and communicating around SEL. So when we begin here with these research-based outcomes, or put another way, these research-based whys, we can kind of see what drives the work of this framework. So whether it's short-term or long-term, these outcomes we see on the left here, these are all things I think we can all get behind, right? We hope, for example, that youth have positive feelings about the environments that they're in, that they are experiencing healthy relationships. And obviously we hope youth will graduate from high school. With SEL, these are more than just hopes. These are outcomes that are supported actually by deep research base. So lastly, the how of how we implement SEL in our school structures, that will follow a theory of action. And you'll see that on the right here. We'll build foundational support and plan, strengthen adult SEL, which I'll get into in a second here, promote SEL for students, and reflect on data for continuous improvement. And in a little bit, Terry will break down that theory of action for us a little more. We'll go to the next slide. So one great resource on DPI's website is our SEL Roadmap. And this is a fantastic tool that can help you navigate through the plethora of SEL resources that can sometimes seem a bit daunting. There are 3 guiding questions that divide these resources. So we'll share that link in the chat so you can kind of explore this on your own. But the main things here that'll guide you through are there's the learning section. So maybe you're at a stage where you're just curious about SEL or just beginning that SEL journey. And this is a great way to kind of start that process of just kind of learning. And then the planning phase, maybe you're ready to analyze your practices, or maybe look at some resource inequities in your district, or look at your evidence-based improvement strategies, that kind of level. And then there's the do. How do you use these improvement cycles to implement and monitor that plan? And then there's the study check. How are we reviewing the evidence of implementation and impact? So it's broken down really nicely and kind of helps districts explore this and at different levels and different stages. And it helps remember that there's a lot of resources behind SEL in the mental health field, and there's really no need to reinvent the wheel or feel overwhelmed by this. So this is a great tool. A lot of districts are already doing a lot of this work and collecting important data. So really it's just about structuring and aligning our efforts. We'll go to the next slide. So another important piece of resource that we have for you all is our guiding principles. And we'll share this link in the chat as well so you can follow along. It's really important that we're anchoring our SEL work in some shared principles. And DPI has created 7 of these. So first there is a commitment to equity. And this means that SEL work is built around equitable and culturally competent decisions and instruction. And it means that SEL skills are seen as a tool to disrupt those inequities that we're finding in the education system. And it gives students the skills to address the inequitable challenges in their world at their level as well. So equity in SEL can help create the environment in which students are valued for who they are and what they bring to their schools and their families and their communities. And this just kind of helps keep that as priority as you're working through this. And second, we also see SEL as strengths-based. And this is important because it's not meant for identifying deficits or making determinations about services. It's about honoring what a student already does well and their capacity for growth. SEL competencies can be a part of an intervention, but they're not usually seen as the reason for additional supports. So they can be connected to behavior, but they're not causal. And then third, we know that SEL is most effective when it's implemented in a systemic manner. So when we're looking at our framework and the why, what, how, kind of like what we looked at earlier, this just kind of guides you in how to measure SEL, but also how to think about it, how to talk about it, and how to communicate about it, and how we're using it in our schools. And fourth, SEL is not just a student initiative. So I mentioned this earlier, focusing on SEL competencies of adults is very important in this system. It can help improve our staff well-being and improve those work environments, build resilience among our adults. And it can also aid our adults in modeling these SEL skills for students, which is really important as we're teaching and reteaching these skills throughout their lives. And fifth, like mental health in general, SEL can not just be the role of schools. And a lot of families feel strongly that social emotional learning and that skill development is the job of the family. And so partnering with students and families, out of school time programs, communities, any other way that we can help promote SEL can really show students that this is a universal skill. These are universal skills, and it helps provide more opportunities for that consistent modeling and feedback as well. And sixth, one of our ultimate goals with SEL is developing and sustaining resilience in, again, both of our students and staff. So strong SEL competence has been identified as a protective factor for many risks many potential risks. So having the ability to cope and thrive in the face of adversity is a huge skill for our students and staff. And then finally, the last guiding principle that you'll find on this document is that the SEL competencies are assessed to learn rather than to sort. So we're assessing the skills in a way that's meaningful to inform how we're teaching these skills versus holding students and staff accountable to a level of learning. So it's more about them getting these skills in a meaningful way.
All right, my name is Terry Lesage. I'm the third consultant you're going to have a chance to hear from today. I'm going to take us home with some of the new SEL resources. So thanks to Liz and Jess for going over all that mental health information and connecting mental health and SEL. What you see in front of you now is one of our new resources that is an SEL, social emotional learning theory of action. It's again based on the work of Castle, and it's structured around those 4 key elements that Jess talked about earlier: the building foundational support and plan, second, strengthening adult SEL capacities, 3, promoting SEL for students, and 4, using data for continuous improvement. So each of those elements have action steps that you can take to move the work forward. As Jess says, it's really the how of SEL. How do you enact change and move that work forward? There's a role to be played, you'll see, in both the district and at the school levels. And in some cases, you'll see that the work is actually very similar and needs to be done in tandem or with a clear partnership between both the individual school and the district in which the school operates. Because as Jess said earlier, when going through the guiding principles, we know SEL is most effective when done systemically. So on this slide, when you get your hands on it, we'll be sharing the slides via the listserv, and we'll also have them posted on our website with this recording of a webinar. You can click on district and you can click on school to get some more details, and perhaps my colleagues could also drop the links for both the district theory of action and the school theory of action in the chat box. I think that would be helpful. Also exciting are a couple on-demand opportunities for you to expand your learning in the areas of social and emotional learning and training. The first is the implementation team training, which uses the theory of action I just shared. In this particular training, teams will learn and understand SEL's theory of action that I just went. So you're going to go in depth into each of those areas. You're going to create a program gap analysis of your SEL work. And you're also going to create a plan for your SEL work with clear action steps in each level of the theory of action I just shared. We also have an on-demand training for training of trainers. That is a course that is done in 8 modules that you can complete at different times as your schedule allows. There's going to be content and activities that you can use to train others in social and emotional learning and deepen their understanding of what that work means. Those modules range from why SEL, what is SEL, various SEL frameworks you can use in your work. You need a framework to move your work forward. Some alignment and coherence work around SEL implementation, how you can advance equity through social and emotional learning, adult social and emotional learning, SEL in the classroom, and then assessing SEL as well. We also have a large number of past training and learning opportunities available to you on our website, and you can learn more about that by visiting the link on the bottom of this slide, or I see that it's been dropped in the chat box for you as well. Now I'm going to foreground some other social and emotional connections outside of just working in the school, because again, we're thinking systemically. One webinar we now have available for you is leveraging the out of school time space to advance your work in social and emotional learning and really mental health in general. It's a webinar that you can watch to learn about how that out of school time space can be leveraged to promote a continuum of care for those most in need of support. So to advance the work that you have begun in the school day and carry it forth into the broader community, you can learn about the different ways you and your SEL-minded colleagues can partner with out-of-school time programs to serve and support the whole child and the whole community year-round. And you can learn about some out-of-school time programs in the state who are already doing this work. And if you don't have an out-of-school time program, you can learn about some potential federal funding options that you could tap into to continue to expand your SEL and mental health work in the out-of-school time realm. The second bullet highlights an SEL and employability skills crosswalk that we recently released. As we know, career readiness is really realized through the weaving together of the SEL competencies and the career readiness skills. I would say that career readiness skills really are SEL skills, and SEL skills is what drives employability skills. So weaving them together has a lot of benefits, including lifelong learning, developing collaborative efforts, and expanding our reach of our work again. That bullet then is also related to the third bullet, which is coming soon and we're very excited about. We're releasing a report on some information we've gathered from the field, so from you all as experts, about how to realize SEL and workforce readiness in the classroom, in the workplace that youth may be at, and in out-of-school time spaces. So we'll announce its availability on the listserv and be sure to post that on our website as well. Another resource we have made available centers on the confusion that sometimes exists around SEL competency assessment. So the terms social and emotional learning and social and emotional wellness often get used interchangeably, but they're not the same. So I'm going to focus on just the one way you can begin to understand SEL competence assessment is to compare it to social and emotional and behavioral assessment, or SEB assessment, and targeted SEB assessment. What we have done at DPI is created sort of a quick guide that looks at these three different assessments horizontally, as you can see on your screen, because I think that makes it pretty easy to tell what they are. The link is available in the chat box. When you get the slides, it's also embedded in the title. On this quick guide, what we've done is we've defined these three assessment areas by both what they are as well as what they are not. We have presented considerations for equity, which with each of these three assessment tools. We have included some frequently asked questions that we have fielded about these three assessment tools over time. And we've also covered some consent requirements for each of these three areas. So it's really important to determine what the outcome is for your assessment, because you will use that desire for an outcome to determine what is the appropriate assessment tool to ensure that the data you're gathering is appropriate for that outcome. So again, for more information about the differences, you're going to want to visit this tool that's linked in the chat box. Well, okay, a little bit more about some other great SEL assessment resources. The first link provided here is Modes of Assessment, which is a tool developed by Dr. Clark McCowan to accompany the Wisconsin SEL competencies. It provides some guidelines about the types of measures to consider for different SEL assessments and each competency. So a mode for each competency would be if you are considering, do I use a self-report versus a teacher survey or some other means of measurement? The resource itself lists PK through 5, so pre-kindergarten through 5, but it could really be used for all grades as it goes through all competencies. Now, the second bullet is, if you're not aware, we have a large variety of evidence-based assessment tool providers who have aligned their assessment tool to the Wisconsin SEL competencies. They've provided that crosswalk, a brief description of what their assessment tool can be used for. So its purpose, its goal, as well as a brief webinar that illuminates the connection between the assessment tool and the Wisconsin SEL competencies and gives you a brief overview of what exactly that assessment tool is for. The third bullet is pretty much exactly what it says, something we're pretty excited about releasing soon. You're going to have an SEL competency assessment training module available on demand. Again, that will be linked on our website, and we'll be sure to announce its availability via the listserv as soon as we have it. It's in the process of being closed captioned, so we expect that its release will be soon. Okay, and then this is just a reminder that all of this information about social and emotional learning can be found on the SEL webpage, which is pretty comprehensive and was just recently redesigned. I am going to just quickly show it to you so that you have an idea of what the new SEL webpage looks like. I'm hoping at this point you can see the SEL landing page. If you can't, hopefully one of my colleagues will let me know by unmuting, as I've had to hide the chat in order to see the website. So if you go to the social and emotional learning website for DPI, there's a lot of information, not only what I've covered, but well beyond that. So we've included here our vision, as well as what's a relatively new framework graphic for us. You can see the 3 domains of the Wisconsin SEL competencies and how they subsume the 5 CASEL areas. We often get asked how the SEL competencies in Wisconsin align to that of CASEL. They are very much aligned, and CASEL was a large partner in the creation of those competencies. Scrolling down further, you can see the guiding principles that just covered. And then we have this new navigation area to help you understand how things are organized on our website. There is SEL introduction, alignment and connections, adult SEL, anything related to students, assessment, and then other resources. So I'm going to point out here that the SEL Roadmap, that's what was covered earlier, is a handy new tool, very much based in the continuous improvement model. So depending where you are in your SEL journey, you can select any of these drop-down areas and they'll take you to the appropriate part on the SEL website to continue your learning, your planning, or your training. I think that's a really handy addition to our website. The theory of action, of course, is available as was discussed today, the ongoing training opportunities, and something that I'd like to highlight that isn't exactly new, but is available, and maybe you are unaware if you're just joining the listserv or something, is we have a large number of case studies and exemplars of practice from colleagues across the state of Wisconsin who shared what their own social and emotional learning practices, in particular with systemic SEL, looks like across the state. So you can see all the different areas of Wisconsin that have been covered. And if you're not sure where to begin, there's this handy SEL case study decision tool. So if there's a particular topic you're looking for, you can click on that and it will lead you in the right direction. Of course, you can always reach out to any of the consultants here on the call with questions about the website or any of the information we've covered, and we'll very happily address that. Under alignment and connections, you'll see things that are outside of the school. So considering out of school time in particular, you'll also see some key areas that we do some focus work on, including equity and in general, comprehensive school mental health. If you're interested in character education, we have some information there. And then teaching and learning has a lot of great resources too. So the workforce readiness I discussed earlier, things with information technology, which has become a large concern as many schools have had to move to the virtual world or the hybrid world. Music and school counseling information we have is available as well. You just click on one of these to expand the different areas to see what resources are available. So adult SEL, we're working hard on that as it is a key part of our own framework and theory of action. So information will be coming soon on how you can advance the work of your own SEL competency development. For students, this is where you're going to find curriculum information. So having a solid SEL evidence-based curriculum is key to moving the needle on developing SEL competencies in students. So here, similar to the assessments I talked about earlier, you'll see a number of evidence-based curricula that have aligned their work to the SEL competencies, provided that alignment, and included a webinar that you can view to learn more about the curriculum and how it works with the Wisconsin SEL competencies. I think I've covered a lot of the assessment information already, but there's a section devoted to that here. That's where the upcoming webinar will, the on-demand training, I should say, about SEL competency assessment will be here. And then the articles and other resources, that is just a ton of other additional information. If you like to input about SEL, there are a lot of popular topics that people ask us or questions, and links to resources where you can learn about those different topics. So again, I encourage you to check it out. Please feel free to contact any of us with questions. Our information is here. You can contact us via email or phone. We now have about 10 minutes to address any questions. I've had the chat closed, so I'm not sure if there's been any in there, but you can feel free to type questions in the chat at this point that you would like addressed. You can also unmute yourself if you're comfortable doing that. And again, we're going to record this webinar. We will close caption it. We will share it out with the slides on our listserv and post on our website. So in case there are no other questions, I'm going to say thank you for taking some time out of your very busy schedules to hear about these great resources. So I am seeing a couple questions about a link for the recording and presentation. That link has not yet been developed, so we have to download this recording, get it closed captioned, and then we will make it available. I imagine it should be available within a week or so, and we'll send that out with the slides via the listserv and post on our website. I see a question about how to do SEL work in terms of teams. So could this work be done by an existing team like PBIS? I think it's a great idea to consider how SEL fits into existing frameworks that might already be in place, including MTSS. And I think Liz is a great resource for questions about how to do that. I'm not sure if she wants to speak now, or if you have a specific question, you can feel free to call or email her.
Yeah, absolutely. So just the more integrated we can make this work, the better. And if you're thinking specifically about integrating with PBIS, there is a framework for that PBIS has. And if you have any questions about that, you can feel free to reach out.
Liz and Jess, I see a question there about how to partner with mental health providers.
So I'm wondering if you could just give a little more information about what specifically you're wondering about.
Sure. So I'm with Children's, and we provide school-based mental health across the state in an integrated model where we provide both therapy and work with teachers, educators, staff. Yeah. And I'm looking at all of these resources, and they're just fantastic. And I'm curious what our role should be as external providers and consultants to the school, because it seems like this really should be a district and/or a school-driven initiative. Do we plug ourselves in, or where we see that this may not be on their radar, or it's because of everything going on right now with schools, this may not be something that they've gotten off the ground? Can we be a driver for that, or should we kind of take their lead as supportive partners and integrate ourselves in where it's appropriate or where they ask us to?
Yeah, I mean, I think it's going to be really dependent on the district and the context. So we always encourage mental health provider partners to be part of the larger planning that happens in schools around school mental health and the system. So, you know, if there's teaming happening around that, if you can be part of that team and help drive the work that way, that's one great way to sort of get some of these, the ball rolling on some of this work. You know, in other districts that don't have teams, maybe that's through the individual consultation that you might do with staff, or through the training that you might provide to school staff. So there's a lot of different ways that you can collaborate, and it's really going to be largely dependent on the context and sort of what's in place. But I think, you know, just starting that conversation with the school or the district is a good place to start.
You know, Liz, if I could jump in there too, one other point I might ask people to consider is if there are existing out of school time programs. As we know, schools are incredibly overwhelmed now, and there's a lot more freedom and flexibility sometimes in out of school time programs that serve the same students, that they may have the means to offer some of the mental health support or services that at this point the school just can't handle offering at this point. And then eventually we would like to see the continued collaboration and partnership grow from both the school day and out of school time.
Makes a lot of sense. Thank you so much.
I see the numbers are dropping, but we're going to hang out still for a few more minutes. If anybody has any additional questions, you can unmute or put them in the chat box.